Well, I think it's a good question, and we're certainly built for endurance from a genetic standpoint and from a physiological standpoint. Our anatomy, our metabolism, every component of it, and of course, our brain is an endurance brain. Um, Specific distances, are we geared for that? Generally, no, but specifically, if you want to compare like a 5,000 meter runner with an ultra marathoner, some humans will be better 5,000 meter runners relative to an ultra distance like 100K or even a marathon. So in that way, yes, there's some specificity from person to person, but generally, from an endurance standpoint, we're all made as endurance animals. I think that depends much more on the individual. Someone who is healthy and fit is not going to have as many limits as someone who is unhealthy or unfit or both, as we often see in athletes. Um, I think when you get to the extremes, where you're on a 200-meter track, for example, and you're running 6 days straight, and you're not sleeping, or you're napping an hour every 24 hours. And I've worked with athletes who have done these events. I think you're now getting to the edge where it may be a little bit unnatural. So I think we can go to the extremes. On the other hand, I think humans and their unique brains have evolved in such a way that they like testing the extremes. And I think that's what you're seeing today. Well, the brain is often the limiting factor. Again, we have to ask, are we talking about an athlete who is well conditioned, an athlete who is both fit and healthy? If we are, then the brain is the limiting factor, because what happens is the body is always sending messages up to the brain, and the brain is interpreting those messages. One of the things the brain is built to do is to restrict our activity if it's going to really do damage to us. But there's a gray area where our body sends messages up to the brain during a race, and the messages are, this is a hard race, I'm having a difficult time, and the brain is saying, okay, and then the question is, are you in that gray area where you're not going to do any harm, but you're uncomfortable? And we essentially have a lazy brain, humans. We want to do things in better ways so it doesn't take as much time and it's easier. And so in a race, we have to toy with all these issues. And I think the best athletes are able to say, I know you're hurting, body. I know your muscles are not comfortable and you'd like to slow down or stop and sit down and have a nice dinner. But we're in this race and we're going to push on, and we're going to even go beyond the level we're at. And I think that's something that anybody can train to do and learn to do without hurting themselves. I think the brain, when it realizes that you're going to do serious harm, you generally cannot override that. Sure, there most definitely is a physiological component to endurance quality, endurance performance, and age. You generally do not see 20-year-old ultra marathon winners. You don't usually see 20-year-old marathon winners. There are exceptions, but generally our endurance develops slowly over time. And as we get into our 30s, we start hitting very high levels of endurance. And we've had plenty of examples of athletes who have performed extremely well in their 40s. I worked with Priscilla Welch, who won the New York City Marathon, the women's division, of course, at age 42. Carlos Lopes won a gold medal in the Olympics when he was older, and then a year later even established a new world marathon record. So I think what we'll be seeing over time is as marathoners, for example, start to flirt with the sub 2 hour mark, we'll see those marathoners appearing in their late 30s, 36, 38, 39, maybe even 40. I think a couple of weeks ago, I worked with an athlete at age 38 who ran a personal best in the Ironman after many years of competing in Ironmans at about an 8-hour, 50-minute and change level, which is awfully good. And I think that's, the media always says, well, gee, that's really amazing. How do you do that? And I say, well, that's normal. It's quite natural for a 38 or a 40-year-old to perform well, perform their best. And I think in the Crete race, we may see some people in their 50s performing in those top few finishers. So no surprise there. Sure, I think there could be some benefit. We do know there is benefit going the other way. So if you're an anaerobic sport, if you're in an anaerobic sport like track and field, or basketball or soccer or some of those sports that are very high intensity sports, having a good endurance base will help you perform better. That's well known. And then I think the common feeling is that if you're a marathoner or an ultra marathoner, doing hard anaerobic interval type training is going to help you too. But it won't help you that much if you build your aerobic system. And as you build your aerobic system, you start getting faster and faster. So someone like Mark Allen, for example, when I was training Mark during his competitive days, his aerobic pace, which is the slower type training, it went from an 8:20 per mile pace when we started, and then all of a sudden it was 7:20, and all of a sudden it was 6:20, and then a couple of years later it was 5:20 and a little bit faster. So if he was able to go at a 5:20 per mile pace at a sub-max heart rate, he's done that without utilizing the anaerobic system. And now if he puts an anaerobic workout or a few anaerobic workouts for a 2-week period on top of that, then that can be beneficial. And that's, in the case of Mark, that's what he did. And I usually recommend for a runner that if everything is going well, if health is not being sacrificed, there's no injuries, there's no illness, progress is being made, and there's time in the schedule, which is a big if, then a 2, 3, maybe 4-week period of anaerobic, not very high intensity, but race pace or a little bit higher, not going above 90% is what I use as a guide. 90% of your max heart rate. That can be valuable, but when we start looking at all the possibilities and what kind of an athlete we're working with, and do they have the time to add that? Do they have the time to recover from that? And so on and so forth. Many people don't, and they don't really pay the penalty for it from a racing standpoint. It is not. It's not a good number because it doesn't relate to performance. So you're in a race, you're say in a marathon, and after 15 or 20 kilometers, two much younger or much older female runners pass you. Now you're a male, and here's some female runners that are older passing you, and they finish, a minute or two ahead of you. Well, their VO2 max is a lot lower than yours, and so what does that mean in terms of the value of VO2 max? We know, generally speaking, that the better athletes, the better endurance athletes, have better VO2 max numbers, but there are exceptions. But there are plenty of people with higher VO2 max numbers that cannot finish a race close to people who have numbers that are much lower. So I don't like to look at VO2 max. If we have those tests, they're nice to look at. Most people don't do them. Most people don't have the availability, or the cost is prohibitive. If you're going to do them, you've got to do them with regularity. I would much rather measure fat burning because it's a better number. Yeah, it's all one big package, and we can't decide one day to train our muscles and then another day to train our metabolism and then another day to train our mind. It's all one package. We can, partly for academic reasons, but clinically as well, we can look at the metabolism, we can look at the muscles, we can look at the mind, we can look at the components of endurance and measure them in many cases, and we can make sure that everything is working correctly and that we're getting the best training response as possible. Certainly when we're training a professional athlete, this is what we get paid to do, essentially. And so looking at the metabolism, that's a very, very important thing. And the first thing you see when you start looking at the metabolism of an athlete is energy. Where does our energy come from? And of course, in most instances, we get energy from carbohydrates in the form of glucose, typically from glycogen stores, and we get energy from fat. And the endurance athlete should be getting a lot of energy from fat. And if that doesn't happen, then we have to tap into our glycogen stores, and they're very limited. They don't take us far. And as soon as they start to waver, as soon as they start to deplete, we slow down significantly quite often. So the name of the game is to build your fat metabolism so that the amount of energy available in the course of racing is almost unlimited, even for the leanest of athletes. We have so much stored fat because it's very packed with energy. So much stored fat that even a lean athlete can go literally thousands of miles on those stores.